Good afternoon. We're so happy that so many of you have been able to join us this afternoon. We apologize for yesterday's technical difficulties and open mic, but we have a tremendous amount of great content to bring to you this afternoon, and we are just going to dive right in. Next slide, please. So we're aware that some essential employers who may be in the audience have been operating throughout the pandemic, or maybe they've been operating at a lesser level. Some have been shut down throughout, but in any event, we're starting to see some lifting of the governmental stay-at-home orders. And so Shumaker is providing this important legal information as you think through the process of how the the pandemic is changing the way that you'll be operating in the future. Of course, we're focusing upon just the health and safety and supply chain matters today. And please keep in mind that these ideas are in a state of flux as the federal, state governments and the industry associations develop all the guidance. But we have been working very hard to bring you all the up-to-date information today. So we're going to start out with an overview of the governmental progress to date. For that, I'm turning to our affiliate Shumaker Advisors and Derek Harley and Andy Herf.
All right, thank you, Regina.
Yeah.
Thank you, Regina. Thank you, everybody, for joining today. Our overview is going to be Ohio specific on some of the changes that were recently made. But before we get into that, I wanted to introduce Derek Harley. Derek is our Senior Vice President of Federal Affairs. Derek, why don't you walk us through what you've seen at the federal level?
Thanks, Andy. So 3 weeks ago, April 16th, President Trump unveiled the federal government's guidelines for opening up America again. It's a three-phased approach based on the advice of public health experts. And these guidelines are designed to help state and local officials when reopening their economies, getting people back to work, and continuing to protect American lives. While the guidelines provide data-driven conditions for states to consider before proceeding to a phased opening and guidelines to follow in proceeding through each phase, decisions on when and how to reopen fundamentally remain state and local decisions. To that end, while it's important to follow what Washington is saying and doing, the federal government's guidance on reopening is just that, guidance. The state orders and directives are what you should pay closest attention to. And in that vein, in a moment, Andy will provide details on what the state of Ohio announced this week about Ohio's phased reopening. But before we get there, let me just say, insofar as the reopening of Congress goes and consideration of the next, I call it tranche of federal coronavirus relief legislation, Senate Majority Leader Mitch McConnell announced earlier this week that the Senate is expected to return to DC on Monday, May 4th. Around the same time, the House announced that they too would be returning to work next Monday. But earlier yesterday, the House Majority Leader, Maryland Congressman Steny Hoyer, actually reversed that decision, citing safety concerns and saying the House would return when it is time to consider the next coronavirus relief bill. So now it's a little unclear exactly when the House will return to business. Having said that, I think we've seen the last of legislation considered in the House and Senate by what's called unanimous consent, which required, as the phrase would indicate, a unanimous consent and approval of all members. Most members, none of whom were present because they're still in their districts and working from home, like most of you. Most members and staff I talk to, though, are eager to get back to work and to have a voice in the process and a debate. And I also suspect that the process for the next bill will not be nearly as quick or as bipartisan as the first several bills. But the discussions about the next response to COVID-19 are happening now. And if I had to guess, broadly, I think it will include more money for the PPP, the Paycheck Protection Program, which my indications are that the second tranche that was just approved could run out in a matter of days again. Probably funding for state and local governments, in what form or fashion, we're not quite sure. Maybe some liability protections, which I know is important to the Senate Majority Leader Mitch McConnell, and probably money for healthcare providers, which are continuing to suffer under the COVID-19 crisis. If anyone has any specific questions or thoughts to pass along as Congress considers these bills, this next bill and any future legislation, I'd be happy to connect with you directly feel free to email me at my D Harley, it's DHARLEY at ShumakerAdvisors.com. I'd be happy to chat personally offline with you or give you any more thoughts or suggestions I might have about what might be on the table in Congress. So that's it. Let me turn it over to Andy to talk about the order from Ohio from earlier this week.
All right, thank you, Derek. In Ohio, the governor has, he's easing back off of the stay-at-home order, and there were a few key developments on Monday. There are 4 different sectors of the economy that are being allowed to open up as long as those employers are able to follow the guidelines laid out in the 3 documents that you see on the screen here. If you need direct access to the documents, go to the website that you see there, coronavirusohio.gov. The Responsible Restart Ohio tab is where you can find these. But let me just go over what those timelines look like. The first one is elective surgeries, dentistry, and veterinary services. I imagine this would also include any other healthcare professionals that weren't dealing with specific coronavirus concerns. So it could be dermatologists, really anything, any other elective surgeries. They are able to go back to work on May 1. If you are an employer in that area, keep in mind you'll still have to follow the guidelines laid out in these 3 sheets. On May 4th, both general office environments, manufacturing, distribution, and construction will all open. And on May 12th, consumer, retail, and services. I want to highlight a few of the things that are in the guidelines. As you can see here, every sector has a category that's considered mandatory and another part that's considered recommended best practices. Under mandatory, all of these sectors of the economy have the following mandatory guidelines in common. You have to be able to ensure a minimum 6 feet between people. And if you can't do that, you have to install barriers. So if it's a cubicle setting in an office, there need to be plastic barriers in between the people if they're not more than 6 feet apart. Employees must perform daily symptom assessment. That means taking people's temperature when they come into work so that the employer knows whether or not that person can be admitted into the workplace. Require employees to stay home if they're symptomatic. Face coverings must be worn at all times, so that's masks. It also requires regular hand washing. And then if there are confirmed cases, again, these are standard across all of the industries. Immediately isolate and seek medical care for any individual who develops symptoms while at work. Contact the local health district about suspected cases or exposures. That one is important because this is also the beginning of contact tracing. And then the last one is if you have an infection, you have to shut down. If it's a store, it's a store. If it's a shop floor, the office, you have to shut down that environment for deep cleaning if possible. And so, again, you can pull those up and see them directly. I think it's very, very important for people who do want to bring employees back to understand that these are the guidelines that the state is mandating. The other issue for retail, again, that's the May 12th deadline. The retail guidelines started with face masks for customers. Yesterday in the governor's press conference, he backed off of making that mandatory, but it is considered a best practice. And I think they are trying to encourage people to wear masks when out in public as well. And so with that, I think that covers really what the world looks like on the state of Ohio and the federal side. I would just say, if you have any more questions about this, you can also contact marketing at Shumaker.com. Shumaker Advisors is sending out daily updates on both the federal and state guidelines and any changes made at the federal or state level. If you would like to receive that and you're not already receiving it, email marketing at Shumaker.com. Thank you.
And thanks, Derek and Andy. I appreciate that. We're, of course, going to be taking a deeper dive into the health and safety aspects, which are one of the areas that you'll see the most change as you have employees coming back to work. This section will go from until approximately 2, and from 2 to 2:30, then we'll be doing the supply chain. So I'm turning it over now to Michael O'Callahan and Michelle Zaru.
Thanks, Regina.
Thanks, Regina. Okay, so that was interesting to hear about the Ohio order. There's similar things, I think, coming up in orders of other states, and we're not going to focus necessarily on any of those specific orders or some of the consensus standards that we think are emerging in the industry, like the Layer Work Playbook, but we're going to focus primarily on OSHA and CDC guidance. So what are employers' obligations? They spring from, for employees, they spring from OSHA. OSHA has made it clear that employers have an obligation to protect employees from exposure to the virus that causes COVID-19. And that's under the General Duty Clause of the OSHA Act and specific standards such as providing personal protective equipment. With respect to protecting customers, if you're in that type of business, it's largely going to flow from the common law. And with respect to employees and customers, another source of the obligation is going to flow from the state and local orders. So you can go to the next slide. Okay, so when looking at this, when we're thinking about putting this together, we're thinking about how do you, as an employer, reduce your potential risk? There's been some talk on the national level about doing something like that, if that's possible, but there are certain things that we think you can focus on now that can reduce your risk, and that is compliance with OSHA, CDC, and other governmental standards, obviously complying with the state and local orders. I think, too, that looking at some of these standards that are coming out that from individual employers and from organizations may ultimately provide a liability standard of care. There's a lot of lessons out there learned by essential businesses that you should pay attention to. A flood of OSHA, CDC, FDA, and other guidance that's changing almost on a daily basis. I just checked today and there's been some changes. The initial, though, and primary OSHA document that we're going to go through initially is a document called Guidance on Preparing Workplaces for COVID-19. Now, this was issued by OSHA right at about the time that the stay-at-home orders were being issued. Some of it is a little bit dated, but OSHA is still referring to it, and some of the guidance is so general that it's never going to be really outdated. So you can move to the next slide. So generally, OSHA recommends that you prepare a preparedness and response plan. And basically, what you have to do, and what you really have to do anyways as an employer, is assess the level of risk at various work sites based upon the specific task by the employer. So you're looking at, in the case of COVID-19, how can workers be exposed? The general public is a big one that we've seen through essential businesses that have remained open during the pandemic. Customers and invitees, deliveries, maintenance people, co-workers, and sick individuals, including those with a high risk of infection. It's non-occupational factors consider as well, including the risk factors of workers such as elderly, existing medical conditions, and the like. There's community spread was one of the issues, and if you look around our communities now throughout the United States, that may seem a little bit dated, but I think this is may come up over time if some of the predictions that we're saying that the virus may be recurring over time may come back in the fall, who knows, but community spread will be something to be cognizant of as you move forward, because the controls that you may employ may change over time. So basically, you implement these controls to address the risks that you identify. So you can move to the next slide. Okay, just quickly, developing contingency plans for things like increased worker absenteeism. We're seeing that in a number of food industries right now. The need for physical distancing. I think everybody who hasn't heard of that, in the past couple of weeks has probably heard about it in the past few days. Other things such as staggered work shifts and downsized operations. So consider options for conducting operations with reduced workforce, including cross-training of employees, and be prepared for interrupted supply chains, which we've already seen a lot of throughout the shutdown so far. So you can go to the next slide. Okay, so both OSHA and CDC and basically everybody out there is recommending implementing basic infection control measures. Many employers had these in place even before they were required to send their employees home if they were non-essential. But that's the frequent hand washing, sanitizing with alcohol-based hand rubs where soap and water are not available, requiring employees to stay at home if they're sick, encouraging respiratory etiquette, all of the common things largely that we've been doing, but now we're seeing some other ones that are growing out of actual experiences that have been encountered by essential employers. And that is developing policies to reduce the potential for workers coming within 6 feet of each other, discouraging workers from using each other's tools and equipment, and maintaining enhanced housekeeping and disinfection procedures throughout the process. And you can go to the next one. So, Michelle, I think you and I have actually encountered this situation, but there's guidance on what do you do when you identify a potential employee. So we'll discuss that a bit, but you have to identify or inform your employees of the signs and symptoms of COVID-19 and ask them to self-monitor. That's basically coming out in a lot of the state orders, and it's coming out in a lot of the plans. And interesting, that changes too. I think it was just yesterday, Michelle, and you may know these better than I do, but I think the CDC identified 6 additional symptoms that people should consider in evaluating their own health check. And I don't have those at my fingertip, but they go beyond the fever and the shortness of breath and coughing. Require employees to report when they are sick or experiencing symptoms of COVID-19. Use health questionnaires at the beginning of each shift, and Michelle will talk a little bit about that later. Temperature checks at the start of each shift. This is going to be problematical for some employers because some employers are simply not going to have the right equipment to do that. And they may not have the appropriate protective equipment for those people who are doing health screenings. So I'm sure a number of alternatives there are going to come up over time. One of them is to ask the employers to check their own temperature at home and to monitor for some of these other conditions. Obviously, isolate workers who have signs and symptoms of COVID-19, send them home and ask them to seek medical attention as warranted. This last one largely applies in the context of first responders and healthcare workers, but protect workers who have close contact with persons who are potentially infected with COVID-19. All of these things are considerations that you're going to have to employ when you reopen for business. And you can move.
Oh, sorry, I was just going to add to that part. No, that's okay. We don't have to go back. I was just going to add that, you know, in practice, what we're seeing is these are very difficult determinations because the symptoms are inconsistent. People are reporting them when they have 1 or 2, which could very easily be something else. So it's resulting in really a judgment call on the employer's part in determining when do you isolate and when do you not, and when do you set those plans in motion. So it's definitely not as clear cut as it sounds because the symptoms are taking all different forms and people are afraid.
Yeah, it's clearly not. In some of our own experience we've had with our clients who have been essential, some of these are just judgment calls, and we lay out options that they may consider. And what you're seeing increasingly in a lot of the OSHA guidance is that if you follow their guidance and make good faith efforts to do that, and you document where it's not feasible to follow that guidance, they will take that into account as an enforcement discretion concept when the dust clears. And I say when the dust clears because I believe that there's a huge backlog of complaints that OSHA hasn't even gotten to that relate solely to COVID-19. So in thinking about, after you do your risk assessment, you have to evaluate what type of workplace controls you're going to employ. And OSHA has used this kind of pyramid for years now. It's not just, I think, in conjunction with the outbreak of COVID-19, but it's basically, the ideal standard is eliminating exposure. You can do that in certain industries or with certain hazards, like putting a guard on a machine. It's awfully difficult to do that in the context of COVID-19. But the thing that we're seeing in a number of instances coming up are the next tier, using engineering controls. And the classic engineering controls, if you've been to your local grocery store recently, will be the sneeze guards that are set up between the cashier and the customer. And in my local grocery store, they've actually rewired the point of sale terminals so that you're, instead of being a foot or two from the cashier, you're now at least 6 feet away. They have other controls that they put in that may not necessarily be institutional, but there are lines you can't cross in certain areas so that you maintain 6 feet of distance. So engineering controls are the next preferred step. Fortunately for us who have not been in business, a lot of these engineering controls have been thought of, and we'll go through some of these. The next one is administrative and work practice controls, and finally, personal protective equipment. So you can go to the next slide. So what are engineering controls? You've probably heard a lot of these before, but using high efficiency filters, if that's possible in your HVAC system, increasing your ventilation rates, installing physical barriers such as sneeze guards and other equipment changes to reduce the hazards associated with being closer than 6 feet. Drive-through and curbside pickup in retail and other settings, those are obvious. Probably 90% of us on this call have used those in one form or another. There are numerous other examples, and I think that there are going to be a lot of new ideas that come up as people get back to work and identify the practical problems with trying to maintain distance as been recommended by CDC, OSHA, and the state orders. So you can move to the next slide. Okay, so what are administrative controls? Kind of like what they sound, some of which we've talked about. Requiring sick workers to stay at home, minimizing contact among workers by eliminating face-to-face meetings, trying to use virtual communications, telework, alternative work and home days, and staggered shifts. Another thing that's coming up, you'll see these in some of the plans like the Lear plan. There's this concept of using, staggered breaks, staggered lunches, finding additional or different spaces to use lunches. I think it may be in the Lear plan where they say have alternating days, let half your workforce use the lunchroom and require the rest of your workforce to use their cars or something out in the parking lot. So a lot of these things are just going to be ad hoc practical things that you discover and implement as you proceed to get back to work. Limiting all non-essential travel. I don't know who's doing much travel now, but for some employers, even local travel is will be part of their daily routine. Eliminating non-essential visitors. A lot of us were doing that before the stay at home. Developing emergency communications plans, and training employees on the risk factors of COVID-19. Some of the stuff we've already talked about, and using PPE where PPE is available. So you can go to the next slide. Okay, safe work practices are basically just encouraging hygiene, hand cleaning, disposable towels, regular hand washing, posting hand washing signs, those types of things. And I think that some employers are finding that they're changing or altering the availability of these materials so they're closer to employees' actual workstations. So you can move to the next slide. Okay, so finally on the pyramid, personal protective equipment. It's one of the most frequently used acronyms we've heard over the past 6 weeks or so, principally due to the shortage of PPE in industries where it's crucial for medical care workers and first responders. OSHA emphasizes that PPE should not take the place of other prevention strategies such as engineering controls. The examples of PPE are gloves, goggles, face shields, face masks, a number of other things, some of obviously which have no relevance to this, but a lot of places you go into, you have to wear steel-toed boots. All of those things are kind of types of PPE. You have to check regularly with OSHA and CDC on the recommended use of PPE because it is changing. And one of the areas where it's kind of been gradually evolving is the use of face masks. And face masks, and I'll talk about this in a bit, can mean a bunch of different things. But initially, at the outset of the pandemic, and even before, CDC and other agencies were saying that face masks really don't provide the average person with any protection. They're hard to use. They're not available. We need to preserve them for healthcare workers. And I think that was the primary motivator behind their message. But that's evolved in part because of what we've seen of actual people at work during the pandemic, where you're trying to find measures that can reduce the potential spread. So we've seen, at least I've seen, a gradual transition from no face mask to now, I believe it is, OSHA recommends that employers permit employees to use face coverings. The CDC recommends the use of face coverings when people are out in public. And then for certain industries, and I haven't read through the guidance in detail, but for the meat and poultry processing industries, they seem to be more aggressively encouraging the use of some sort of face coverings. So quickly, PPE must be selected based upon the hazard, properly fitted, although there's been some relaxation with that, and there's a distinction between what's a respirator and what's another face cover. Consistently worn, regularly inspected, and employers are obligated to provide it when it's required, which is something that we'll talk about briefly in a few slides. So you can proceed to the next slide. Okay, so OSHA also uses another pyramid to classify worker exposure. And this is primarily in the context of determining what type of protections you need to consider providing to your employees. So at the top of the pyramid are very high risk and high risk. Most of these are basically healthcare workers, first responders, people in prisons where you have a really crowded environment, mortuary workers, and others. At the very highest are the ones who are performing procedures like intubation, where you're going to have aerosol generating activities. These two areas clearly require some form of PPE. Typically, they require some form of a respiratory mask, and the most common one that everybody probably knows about right now are those N95 masks, which basically are designed to seal to your face and significantly reduce the threat of exposure to the virus to people who are wearing them. But most employers, I suspect, at least most employers on this call, are going to find themselves in the medium risk and lower risk. In the medium risk, depending on the type of activity, some PPE or other measures may be required. Perhaps the most common example that is considered to be medium risk are high volume retail outlets like grocery stores. And so they've striven to employ administrative controls and engineering controls to reduce the need for PPE. But now in a lot of these locations, for example, my local grocery store, you see almost all of the employees, and in fact, a lot of the customers wearing some sort of cloth face mask or other face covering. The lower risk jobs are the ones, oftentimes an office environment where you have low traffic, where you have low potential for general members of the public from interacting with your staff. These are the types of ones that generally do not require any PPE, but will require other measures. And so you can move to the next slide. Okay, so this is 2 slides long and probably too long, so I'm gonna, it's partially obvious, so I'm gonna just kind of jump through this. Obviously, with your employees, they're gonna have, many will have different duties throughout the day that will affect their exposure levels. Some of their activity in the morning may not require any PPE, but other activity in the afternoon, or depending on their type of exposure, may require some PPE. So depending on the type of actual activity they're engaged in, you're going to have to consider what other obligations are necessary to try and prevent exposure to COVID-19. So you can skip 2 slides, please. Okay, that's great. So one of the most confusing things out there for a lot of employers, especially the people who are essential, is, what are the differences between respirators, masks, and face coverings? So respirators are tight-fitting masks that create a facial seal, and I've given one example of theirs. There's other kind that are full face and half face that have multiple filters in them, but clearly the most commonly used and least available seems to be the N95. Those are typically reserved for healthcare workers, first responders, and others, and they're largely unavailable and may be unavailable for a long time. Those types of masks are subject to the more detailed respiratory protection requirements under CERP, under OSHA. Some of those have been relaxed slightly. Surgical and procedure masks are not respirators and are not subject to the same more stringent requirements that respirators are. And those are, there's an example with the picture there. Those are also very hard to come by. I was just checking out of curiosity whether you could order those on Amazon. You can, but it appears to be very limited, and the time frame in which you'll receive them, at least when I checked, was sometime in late May, maybe even later. Face coverings. Now, face coverings are a lot of different things, but it basically means cloth masks, scarves, and bandanas. Some of these can be purchased online. A lot of them can be made at home. Some can be made simply out of bandanas and rubber bands. These are primarily designed to protect the person who is exposed to the wearer. Obviously, they offer significantly less protection if you're exposed to somebody who's going to have COVID-19. Finally, face shields are PPE, and they're often used in conjunction, either alone or in conjunction with respirators, masks, and face coverings. They're also being considered for use by a number of companies where they cannot eliminate the 6-foot distancing between employees on a continuous basis. So you can move to the next slide. Okay, so throughout the pandemic, because of the shortage of PPE, OSHA and CDC and the FDA have had to get a little bit creative with their guidance and their requirements and relax them. They issued a rule, maybe a guidance 2 weeks ago or something, that allows the reuse of respirators and the use of expired respirators in certain instances. And they have particular procedures that have to be followed. So again, even if you had access to N95 respirators, some do, but most don't. If you do, there's guidance from OSHA that allows these to be reused and extend the use of them so that you can essentially preserve the supply. The current guidance, though, prohibits healthcare personnel from using expired respirators. You can move to the next slide. Okay, so here's the newest CDC guidance on cloth face covers. And this came out on Monday, not as a standalone, but it came out as part of the guidance that was issued specifically tailored to the meat and poultry processing industry because of the significant outbreaks in plants in South Dakota and throughout the country. And they added a lot more detail than I anticipated that they would. And I'm not going to run through all those, but it appears to make it a little bit more burdensome for employers. And the thing I would say right now that if you're going to permit your employees to wear face coverings, or if you have to, which looks like some employers have to under the Ohio order, I think you're going to have to develop your own program and use good faith efforts to comply with the newest CDC guidance. In fact, Michelle, something came up the other day too about what do I do? How do I clean these at the end of the day if I'm an employer? Do you want to elaborate on that? We had a little exchange on that I think is more practical than anything.
Yeah, I think the question from the employer was, if I provide these masks, do I have to be responsible for cleaning them? And generally, or do I have to pay for the cleaning of them? And generally the rule is where the items can be laundered with your regular clothes, like cloth face covers can, that the employer doesn't have to pay laundering costs to the employee to do that. And the employer, really, most employers right now are not in a position to wash masks themselves in mass, and whether they can contract with someone to do that, that would be okay. But realistically, I think it's going to be difficult for the employer to take the masks, wash them, and give them back. So what we've recommended is that they provide instructions to the employees about how to wash them, when, how often, and just kind of confirmation that employees understand the maintenance requirements of the cloth face masks.
So that's an example of some of the practical advice we've had to provide to employers recently. We'll have another example of that, or one or two going forward.
Yeah.
So you can move to the next slide. Okay, so OSHA record keeping and reporting, and this is, Michelle, this is the exact one I'm thinking about because we both advised a couple of employers on this. Right. And it came up in the first context before OSHA's new guidance, and that was, do I have to record COVID-19 injury? Is it a workplace injury? And at the outbreak of the pandemic, OSHA actually had guidance on its website that says, yes, it is recordable. And so we were consulting with a couple of our clients on this, and we said, look, you're going to have to be practical when you go through this. You have a lot of other things going on right now, a lot of other more important duties to tend to. And in most instances, if you have like a single case of COVID-19 in your workplace, you're not necessarily going to be able to determine, it's almost going to be impossible to determine whether that was a workplace exposure. If you have something at like some of these large meat processing plants where you have hundreds of people, it's maybe even less than that, you probably and may very well have a workplace exposure. So, what we were encouraging at the time is basically try and make your decision, make it in good faith, and move forward, because for many of them, there were just too many things breaking on at the time. And interestingly, this obviously, the OSHA was seeing this probably throughout industry, because just about 2 weeks ago, they issued new guidance that says that says they will employ enforcement discretion when it comes to this issue. And so outside of the emergency, first responder kind of environments, OSHA is not going to enforce the the record keeping or the recording requirements for it, except where there is objective evidence that a workplace exposure has occurred in connection with COVID-19. And they give an example of a couple of examples of objective evidence there. And that actually caused some people to become concerned that OSHA is going to be second guessing their decisions and the like. And I take that not to be the case, because the guidance clearly says at the end that they want employers to focus their efforts on implementing good hygiene practices throughout the office. So clearly, here's another example, and that's why I say these good faith efforts, I think, are going to be, you're going to see more and more of these as we get back to work. You can't get tied down in the minutia of complying with some of these OSHA requirements if you are in fact making good faith efforts to comply and trying to spend most of your time actually promoting good hygiene and doing other things that are going to reduce the spread. So I think that there's a reasonable basis to look at this guidance here and other guidance that they've issued with respect to good faith compliance, and think about your compliance plan from that big picture perspective. And you can move on to the next slide. Okay, so Michelle, you and I have had some actual experience with this too, and part of it was kind of not entirely made up at the time, but you know, this was very early on in the pandemic, and we had a couple of instances where at the time they were actually suspected workplace exposures because basically testing wasn't available to most of these people. And Michelle, do you want to run through kind of the things that we've talked about with the employer? And it doesn't necessarily have to be in connection with this particular slide.
Yeah, no, I think the first, when employers are calling me with, oh, we have a positive case, well, the first question I always ask, is it a suspected case or is it confirmed? And if it is suspected, how suspected is it? So there's degrees of these things. You know, it's one thing if you have an employee who definitively tested positive and is hospitalized. That's the very clear-cut situation, and those have been relatively rare. Most of the calls I've been getting has been on the suspected side. It's where they've ruled out strep throat, they've ruled out flu, they have all the symptoms or many of the symptoms on the CDC checklist, which I did take a look at that. The 6 criteria that the CDC mentioned yesterday included chills, which had not been on there, whether they were frequent or intermittent chills, headaches, and then new loss of sense or smell. Those were some of the symptoms that the CDC identified yesterday. But ultimately, the question is, you know, what's the suspicion and how strong is the suspicion? Because is it just a generalized, I feel sick, or is it, I was with my sister and my sister definitely has it? You know, so we've been weighing all of these different things and deciding based on the severity of how we would respond. If it's something, you know, if it's someone, we had someone who was driving to work and drinking a Red Bull and then couldn't taste the Red Bull. Well, the Red Bull is a very strong flavor, so normally you could taste it. You know, we sent that person home, but didn't necessarily implement all of the, you know, steps on the checklist. For someone whose significant other has been diagnosed and tested and has it, and they started to feel sick, then you would implement what's on this slide. And I don't know if you want me to go into this list, Mike, or if you're going to jump back in.
We actually had to go back and forth to the OSHA guidance and the CDC guidance to try and advise our employees. And, you know, one of the things that we've come up with, one of the things that we kept on coming up with is, well, how do we tell them, what do they say to the employees who may have been exposed to the employee who is suspected or confirmed to have COVID-19? And again, most of our cases were suspected cases. They clearly had some of the symptoms. Okay, so the suspected cases were sent home, but what do you do with the potentially exposed employees? Who are the potentially exposed employees, and what measure do you use to determine whether it has been a potentially serious exposure. So I think in a couple of the instances that we actually had, working with some other people, we said, try to identify the people on your own that they've worked with closely and communicate to those people, but don't disclose the name of the employee who is suspected or confirmed to have COVID-19. Another one that we've seen some employers use, and we may have recommended this ourselves, is ask the employee if they will waive the right in writing so that you can disclose their name for two reasons. One is to get a better sense of who they will actually be exposed to and have frequent contact with. Was it somebody at work? Was it somebody that they were carpooling into the office with? Those types of things. But another thing that some employers wanted to do was to prevent the fear of the unknown inside the workplace, because everybody's going to know that somebody was sent home and either suspected or confirmed to have COVID, and everybody's going to think that was somebody else, somebody that they were close to. And so for some employers, they've actually wanted to try and disclose that name, and we've said you can do that if you have it in writing with written consent from the employee. And quickly, so we don't take up too much time, one of the things we've struggled with too, we've all seen the 6-foot rule. What's the duration of exposure? And I've never really seen anything on that except for a presentation by, I think it was an epidemiologist at Ohio State, who defines it as anything longer than 5 minutes. Now, prior to that, I would have thought 5 minutes is a very short period of time. Because that could be any employee in a locker room, any employee, for a change. Certainly everybody in the lunchroom who's not 6 feet apart. I'm still looking for something on that that would say what's the exposure duration. In the meantime, it's sort of a sense of who would be the employees who had most frequent exposure with the person known or suspected to have COVID-19. So what else do you do in terms of notifying the employees? You sanitize the area's equipment and tools, and for some instances, you do temporary closures of the facilities for deep cleaning. And we've seen this in a couple of instances in essential businesses like grocery stores. And part of that may be a combination of, seriously trying to eliminate the threat to customers and employees, which is great. Part of it may be trying to eliminate the fear of some of your customers, which probably makes a lot of sense too in some instances. So you can go to the next slide.
And here's where I'll jump in.
We're going to transition primarily to you at this point, because I've been talking too much and I don't know anything about what's coming.
Okay. So one of the key issues you're going to have to address as you reopen, or even as if you've been open this whole time as an essential employer, is your workplace policies, and some flexibility is going to be in order here. You certainly want sick leave policies that are consistent with the public health guidance to the extent possible. And we understand some of you are in unionized environments, that's not possible. You can't change things on the fly. And some of you are not going to just be able to, because you need people to be at work as much as possible to fulfill your customer requests and for production reasons. But you certainly want sick people to stay home as required. One of the key questions the employers have been facing is when employees come forward and they need leave, are we requiring confirmation from healthcare providers, and what form does that take? And to me, what I've been instructing employers is generally to be flexible, except, normally some employers, they only want a specific form, their own form, to be signed by the doctor. And, I think now we have to relax that a little bit, and, accept an email, accept something signed by a nurse practitioner or a teledoc. I don't think we can have a hardcore reliance on paperwork when it's harder and harder to get that paperwork now. You may have to work with your insurance companies and different agencies just to make sure that employees are getting medical care they needed. If testing is done, how is that going to be covered by your insurance? And if you're still having furloughs or layoff, you want to make sure you're clear on my insurance policy will remain in force while people are on layoff, and employees will pay a certain portion still, or we're going to relax the employee side payment and keep the insurance, or they're going to have to go on COBRA. So I think that's a question that employers have to work with their own insurance companies to make sure they're addressing. And it would be good for you to know ahead of time before you reopen, how all that's going to come into play. And then, the final element I think is really helpful, and it's what Mike mentioned at the very beginning, which is we want to train workers when they come back. This is a new world order, new requirements. So make sure you have information readily available, and employees are going to be confused and a little scared. So the more information you can provide, the better. Next slide, please. And along the lines of that training, I really think, I can't stress enough the importance of employee communication plans. When you have employees who are on the edge and nervous, when they're being recalled, they're especially nervous because they don't know whether it's safe. The best thing that you can do is think about how you're going to communicate with your employees and then adhere to what you set out in your plan. So, and your goal is always to maintain as much calm in the facility as you can. Employees are going to ask about suspected cases, they're going to ask about confirmed cases. If anyone's out of the environment, they're going to assume that person has the virus, and they're going to become kind of panicked about that. They'll be watching attendance, so you're going to have an answer for that. They're going to want to know whether you have a plan in place. And to me, I think telling them is a great idea because it does provide that reassurance. It shows that you're on top of things. And they may assume that whatever you're doing to social distance is not enough, and they may want to ask about compliance. And in many cases already, employees have called the health department to complain that they didn't feel like their employer was doing enough. And we've already had some inspections where the health department employees have been coming on site and walking around to make sure. Sometimes it's been by a phone call, sometimes it's been on site, but understand that those inspections are going on. So it's really important that you do try to comply. And in one case, an employer told me that they had gotten a certificate, like a letter from the health department saying they were meeting all the social distancing requirements. And they actually handed that letter out to all their employees. And I thought that was a genius idea because it provided that reassurance and it kept people calm. Okay, they're doing everything they're supposed to be doing, and that's going to prevent future calls to the health department. And for another client, I recommended, if they just got a phone call from the health department, but they understood that employees were nervous, the ones that were being recalled. And I said, maybe you want to invite the health department on site and get that letter so that you can show it to your employees that you're in compliance. I think you have to feel good about the steps you're taking before you do that. But I think the health department would be willing to work with you in ways to take the steps that Mike described earlier if you did that. So once you have your,
I think that, is really a practical point here, because OSHA has something well over 4,000 uninvestigated complaints relating solely to COVID-19. And I think a number of my colleagues and myself have actually, prior to non-COVID, in the non-COVID area, we've actually had to respond to complaints issued by OSHA that typically arise when an employee, sometimes they're cranks, but in many instances and fairly legitimate circumstances, they were concerned or questioned whether an employer was taking seriously a potential workplace safety issue. So you could conceivably reduce the potential for OSHA complaints under these circumstances.
Exactly. So in terms of your communication plan, determining how are you going to communicate? Is it going to be case by case? Are you going to do a weekly meeting just to round up, a weekly written memorandum? Or in like the case of our firm, our management is sending a regular email every week or so. Do you want to provide government guidance? Do you want to provide other information? I think whatever you decide to do is fine. I just encourage you to do something because I think it'll prevent a lot of problems that you'll face down the road if you just don't address it right up front. Next slide, please. Mike mentioned early on temperature checks, and the CDC guidance is recommending that. I know the governor would like all employers to be giving temperature checks. And the EEOC, the Equal Employment Opportunity Commission, has expressly permitted it and stated that it's not a violation of employee privacy, as a medical exam of employees. So there's a good reason to do it in the sense that it provides calm to the workforce. They feel like you're screening out people who might be sick. But it poses, Mike mentioned briefly, it poses so many problems from an employer standpoint. First of not the least of which is who should be doing these checks. If you're going to have someone actually taking temperatures, is it fair to ask a receptionist who maybe didn't sign on to do this to take the temperature checks? Is there a way to have someone in health and safety do it? Or if you have a nurse or medical professional, of course they should be doing it. But the CDC recommendation is really to have employees take their own temperature while they're observed from 6 feet away by an employee of the company. And that way you can at least see if they have a temperature or not, instead of just taking their word for it if they do it at home. And generally the guidelines provide that a temperature of 100.4 or above is significant for COVID-19, is considered a fever. And that in addition to taking the temperature, the observer should be looking for a visual inspection of signs of illness like flushed cheeks, fatigue, I don't know, chills maybe. I don't know what else you can actually see on a visual inspection, but that's what the CDC says. You need to decide as an employer, what records are you going to keep of the checks? If you do keep, I don't think you need to take any record of someone who's negative and doesn't have a fever. I would much rather there's no written record of that, just to minimize the amount of medical information you're maintaining. But if you're going to keep a record of people who are positive, you need to keep those separate from their personnel file and a confidential medical file. And keep in mind, employees, if they're going to have to wait in line to have their temperature taken for any significant time that's not de minimis, then we need to make sure they're being paid for that. So you have to think about, again, this is part of your engineering controls. Is there a way to move the time clock so it's right where they're waiting to have their temperature checked, or can they walk to the time clock in, and then go back for the check? And then always the overarching concern is privacy. How do you keep these checks private so the whole plant doesn't see the employee who has a fever walking out of the building? Everyone assumes that they're the infected person that's going to infect the whole plant. We really want to try to avoid that to the extent possible, and in some settings it's just not possible. So again, you can avoid this by having the employees take their temperatures at home and affirming to you upon arrival that they're clear, but that doesn't provide the assurance as the temperature check does. So it's really a mixed bag. Next slide, please. The other tool you have that I think you should be using are health questionnaires. These are very short. It wouldn't go into background or whatever. Primarily, you're just asking, do you have symptoms of the illness? Have you been exposed to anyone who has it? Have you traveled? And then if you're going to have them take their temperature at home, you would add that to the form as well. And I would include on the form something like, you understand that you could be terminated for dishonesty if you're not providing truthful information. So as a reminder to employees, if you are having a temperature checker at the front door collect the health questionnaires every day, they need to be trained. They need to be trained not only in how to check a temperature and what the fever actually is, but also on how to review the form and what's significant and what makes an employee have to leave and what enables them to come in the building. So don't forget training for the temperature checker as well. Next slide, please. Some of the other return to work issues generally, as you are requiring your employees to come back, is to think about your order of recall. Are you recalling based on seniority, pursuant to a union agreement, or just based on need or specific product lines? It's always helpful to have that in mind before you start calling back employees. We had some questions before the seminar that were emailed to us, and one of the questions was, well, what do I do with my high-risk employees? And I've gotten calls on that as well. And should I recall someone who I know is pregnant? Should I recall someone who I know is older? And my advice is at least have the conversation with them. Many times they'll come back with medical documentation that will let you keep them off if there's a medical condition, and you can consider it an accommodation. They'll keep getting their unemployment, and then you can go to the next person on the list. But I think these are really tough questions that you have to You have to think about your union agreement if there is one, your procedures, what you said when you laid them off in terms of how they will be recalled, and what your needs are and what their needs are. So there's a lot of considerations, and it's hard to give just a one size fits all advice on that. Keep in mind, employees may be very reluctant to return once the unemployment is in place for the pandemic unemployment assistance. I'm not sure any of those checks have gone out yet, but this is going to make it, in some cases, people are going to make more money on unemployment than they made as an employee. So that, because it adds $600 a week to their unemployment, and the maximum amount of unemployment in the state of Ohio is $487 a week. So they could be getting, $1,100 a week to be off work. They don't want to return. And so when you're facing that, you have to decide, if you're recalling these employees and they're saying no, do you want to let them stay off, or do you want to terminate them for not refusing to return? I mean, these are the hard choices. Keep in mind, there are people who have a genuine fear of returning, whether for themselves or others that are vulnerable that live with them or interact with them. And so again, you have to decide this question: do we let them stay off because they're genuinely afraid, as opposed to the person you think might not have a genuine fear? I don't think we can really determine that. So you have to decide your policy. Are you just going to recall everyone and just take the medical cases on a case-by-case basis? I don't think that it would be lawful to have a policy where you return to work everybody who's under 65. I see that as a discrimination claim waiting to happen. You may think you're protecting your older workers by doing that, but you don't know, there may be a certain percentage of those older workers that want to come back and want to be at work. So that may be very detrimental to them. So any assumption you're making about someone's risk category can be very dangerous. And I encourage you not to make decisions on those kinds of on those bases, and really look at your business needs and let employees come to you if they have an individualized safety concern. Then remember that once employees are back in the workplace, the Families First Coronavirus Response Act, I call it the Families First Act. Everybody else likes FFCRA, which I feel is a mouthful. But now if you're under 500 employees overall, your employees are eligible for paid sick leave or paid FMLA for childcare reasons now that they're back at work. So those issues are going to arise. And if you haven't had to really wrap your arms around it yet, give me a call, because we're going to be having a lot of conversations about it. But the main issue is, determining who needs to be off, if they're entitled to their paid sick leave, and then they may have childcare leave as well. Next slide. Oh, there you go. Okay. I wanted to just speak a minute. I'm already a little bit over, but I just wanted to speak a little bit on liability. This will be in the materials that we'll send out as well. But generally, for employees who get the virus, there's a question of whether they qualify for workers' compensation. And in Ohio's statutes have a list of scheduled occupational diseases, and all of those automatically qualify for a potential workers' comp claim if you can show they were, incurred during work. But coronavirus is an unscheduled occupational disease, and so you really have to go to a different test, which is whether the hazards of employment that the employee faced while working were greater than the hazards faced by the general public. And I would say generally that's not the case with coronavirus, unless you're a first responder, a medical professional, or you're on that very high risk pyramid that Mike showed us earlier. So, and even the BWC's frequently asked questions say this answer, few jobs have a hazard or risk of getting the diseases in a greater degree or different manner than a general public. So most likely most workers' comp claims would be denied on this basis. I think it just depends on what type of occupation you're in and whether you're in a more high risk setting, as we discussed, and those claims could be allowed. Similar rules are in place in most states, and I know someone had asked about Michigan, and I looked into Michigan specifically. They actually passed a statute that provides for workers' comp for coronavirus cases for first responders, like emergency crews and healthcare workers. Ohio has a statute kind of on a bill pending, but it doesn't look like it's going to get much traction on that. I think because the Ohio test will probably end up covering those healthcare workers, I don't know that the bill will go anywhere, but we'll keep watching on it. And then next slide, please. The other risk is Ohio intentional tort, and that is available to employees whose employers acted with such, disregard and for their life that they had the deliberate intent to cause an employee to suffer an injury. And I think the only way an employee could show that the employer committed an intentional tort against them is if they literally did not do any of the things we're discussing today and just sent them back to work. And even then, I think it's a tough case under the Ohio intentional tort standard, which has been tightened up in the last few years and very difficult to prove that deliberate intent. And then the next slide. The one other thing to keep in mind, I mentioned employees were calling the health department and making complaints. There is liability for violating the director of health's order. And, essentially that could be $750 fine and 90 days in jail for a first offense. Corporations can similarly be guilty of that type of violation, or they could be guilty of like a complicity offense where they induce their workers to violate. So keep in mind there are some penalties involved. The governor has said repeatedly in his press conferences, he wants people to comply voluntarily, and that's what you should be doing. And frankly, consumers, that's what they're looking for. They want to support the businesses that are voluntarily complying with these steps that we've been talking about. And you want to keep your employees safe, so you want to comply as well. Thank you.
Well, thanks, Mike and Michelle. There's certainly so much information to think about from an internal standpoint, but there's also a lot to think about from an external standpoint. When we say reactivation of the supply chain, not all employers have been considered a shutdown, but in Northwest Ohio particularly, the automotive and building supply industries have been pretty much shut down since about mid-March. So when they start thinking about coming back online, maybe by mid-May, a lot of things are going to have to change. This is a new, next slide, please. This is a new era. They need to figure out who's able to supply. They need to determine for themselves, well, what do we actually need to come back in. Before the shutdown occurred, some manufacturers looked ahead, got stocked up on raw materials, maybe some finished goods. But for the most part, manufacturers are going to have to figure out, well, what are their supply needs right now? And if they start sending out notices to the suppliers that they expect them to start delivering product by a certain date, are they going to be able to do so? In most industries, the supply chain is comprised of various tiers of suppliers. Some at the higher levels are particularly able to weather a storm like this, but if you go down to what they call tier 3 and 4, those suppliers are more thinly capitalized. They might have lending facilities that require on payment for accounts receivable, or lending on accounts receivable, or other financial covenants. And there are a lot of things that need to go into figuring out whether or not particular suppliers will be able to supply, so that the manufacturing floor doesn't go down because a single source supplier can't supply what they're getting in. So there's a lot of things to anticipate ahead of time. Generally speaking, going into this, most suppliers at the present time might not have been in too bad a shape, because the economy was going so well at the beginning of the year that they might have had some good accounts receivable coming in. They probably applied for stimulus payments to the extent that they could. So that we haven't really heard that many accounts of people declaring bankruptcy, at least in this area in automotive. There might be some retailers that are not faring as well. But we think that the worst is yet to come on this area. Next, please. So we'll see about how the financial stress pays out. Obviously, people have not been getting orders, so their accounts receivables are declined. The stimulus programs are expiring. As you heard from Mike and Michelle, there's a lot of additional expense involved in maintaining the new health and safety requirements. And probably what other orders were expected to come in are very unpredictable. Yet, if the top tier manufacturers want a lower tier to be ready to supply, then they might need to replenish their raw materials. They need to replenish their supplies at a time when they're uncertain about what their liquidity is. So we'll discuss troubled suppliers a little later. And next slide, please. As we're doing this, we're assuming at this point that everyone is attempting to work together on a cooperative basis, that the manufacturers will be sending out notices to the suppliers, trying to get a feel for what the needs are at the lower levels, whether they'll be able to continue to honor existing purchase orders and commitments under purchase agreements. There might well be a test that everyone wants to do, because it will be important to see, and until someone is actually operating, it's hard to know whether this vast array of participants in the supply chain will be able to deliver whatever the new commitments are. And I would assume that volumes may need to be scaled down. But if the volume is scaled down, there may be some suppliers who may not be able to profitably operate at that level because their pricing was based upon a certain level of volume. There may need to be discussions on how that can be supported. And let's see. I think everyone is anticipating that in this very unusual circumstance, that there probably will be some hiccups that occur as they try to reactivate, and then they may find a single source supplier is unable to deliver, or just a number of suppliers taken together are not able to deliver. But supply chain managers are very experienced, and we hope that that period of uncertainty will not last too long. Next, please. So in preparing for this circumstance, the lawyers can really help by looking at the supply agreements and looking at what standard terms might need to be reassessed. Some obvious ones are forecasting requirements, what the level of commitments were, might require an addendum to the agreement, but it might be adjusted more easily by the business people working together. And as you may have heard, some of the new lifting orders from the government reserve the right to shut down again, perhaps if ICU admissions rise above a certain level. So we might see this very unusual circumstance where people get operating again, and maybe in a certain region, the pandemic seems to be taking hold again. So they might be shutting down again, or you might have regions of the country opening unevenly throughout the supply chain, which is going to make it very difficult. Transportation carriers are having a different period of different set of experiences right now. So it can be difficult, even in this present environment, to be getting the haulers to come in on a reliable schedule, so that the usual firm delivery requirements might need to be given more discretion and penalties waived so that these suppliers are working together in a very cooperative manner to get through this session of the economy. Now, you might also consider, as part of this, and having a special addendum to the agreement that will talk about how certain provisions of the agreement are suspended for a particular time, because you do want to enforce the agreement as written once this period of uncertainty is over. You probably want to return to fixed pricing if that's what is in your agreement. A lot of people have been relying upon force majeure clauses, but that is difficult to work in this environment, even if that some people might have invoked them initially, because the pandemic is now a foreseeable event. It's not really an act of God. So we think it's better not to have this broad force majeure out, which would make the terms of the entire agreement unpredictable on what exactly provisions are effective, and instead look at how you can mutually agree on how things will be handled during this period of uncertainty. Perhaps lead times for getting raw materials will be changed as suppliers determine when raw materials would actually be available for delivery. There may be some suppliers asking for payment terms to be extended for a period of time. So all of these are different things to consider. Next, please. So you would want to be looking at the supply agreements to see what kind of things might need to be done on a short-term basis, what forecasting could be done. You might look at termination clauses because there may be some suppliers who will be troubled and you need to address that situation, have more backup suppliers, particularly in different regions in case a certain area of the country is again subject to a shutdown order. An entirely different set of things to consider is what is the protocol for receiving deliveries at the facility. As you probably have heard, the virus might survive on certain surfaces for a fairly long period of time. If you're getting equipment or components in that might be readily picked up and put onto the production floor, how does one make sure that it has been properly screened? You probably won't have time to leave it out on the dock for 14 days or whatever it is that might be applicable to the particular material that is applicable. But what hygienic properties do you need to have in coordinating with your supply chain partners? And I know that Mike referred to a Lear manual. They have a section in there that you might turn to for ideas on what could be done to coordinate smoothly the supply chain deliveries. An entirely different set of agreements that you would have to think about is if you've been outsourcing various services. Some of them are outsourced on a regular basis and might have people on site on a daily basis as if they were employees, or they might be service people that only come randomly when a particular machine breaks down. In any event, you need to make sure that those people are complying with your on-site requirements. A provision in the agreement that simply requires vendors to apply with applicable law might not be sufficient because some of the information that is coming out from the governmental agencies is in the form of guidance, and employers might be free to make higher standards, adopt a guidance, whatever, but you might not be certain that a vendor would be coming in. Vendors might not have masks. They might not be ready with temperature checks. So some of the agreements might need to get an addendum, or sometimes people incorporate a supply chain code of ethics code of supplier chain code, so that you can make sure that everybody is aware of what your requirements are. And if there's any training videos that you show to employees, you probably want to have vendors become aware of what the contents of those videos are as well. We also mentioned earlier that there are that you may be taking the temperature checks, that the EEOC has made a determination that those things do not violate the privacy laws of the US. But there are other privacy laws. It may not come into play, but I note that the GDPR and all the European countries subject to the GDPR have issued different protocols on the retention of healthcare information. So in the event that you have any health information that is going cross-border, you need to make sure that those laws are also being complied with. Now, there are some other governmental orders that are out there, executive orders. Matthew, are you on the line and unmuted? Okay. Could you give us a brief outline of what orders might a manufacturer might be subject to?
Besides any state orders that you know, the governor or Department of Health might issue with respect to, you know, how to address employees, there's the Defense Production Act, and we've already seen just in the last 24 hours the president utilized the Defense Production Act to get the meat processing plants back to work despite the outbreaks. And you know, one of the things he's doing is declaring the meat and the poultry as part of the critical infrastructure to the national defense, and you know, requiring the Secretary of Agriculture to basically step in and prioritize the distribution and the supply of meat so that grocery store shelves are you know, not empty. And depending upon what happens in the next couple of weeks, there's certainly the possibility that there may be other items that pop up or other supplies that we discover are in short supply, and the president may you know, issue such an order to those industries. So it would be a good idea for manufacturers and suppliers to, you know, be dynamic and watch the news and watch the executive orders to determine whether or not they might have to ramp up more quickly than they expected in order to be able to meet the government's demands for a particular product that might be scarce and critical to the United States.
Yes, that's very uncharted territory. During World War II, a similar commandeering by the government took place, but then we had a very clear declaration of the war, and there was a treaty ending the war. In this case, although we had a declaration by the president in March that set the stage for using the Defense Production Act, it's very difficult to know when the pandemic is going to be considered over, which, you know, is part of the problem with using the force majeure clauses. Pandemic could be anywhere in the world, yet your particular area might not be that affected, and so you would not want the force majeure clause to be letting someone be excused from their supplying requirements. But also under the Defense Production Act, infrastructure seems to be in the eye of the beholder as we're looking at it. It could be any communications industry. The internet anymore probably could be a critical piece of infrastructure, but there's just no guidance on what this might be. So could you move to the next slide, please? And there were some other executive orders. Are any of those likely to affect or interrupt someone's manufacturing?
I suppose they could. You know, one of the things that the president did was try to make sure that we were prioritizing, you know, items like ventilators and the N95 mask that we spoke about earlier. there's a possibility, I suppose, that there could be some product that the government feels that another manufacturer is capable of supplying, and that they swoop in and request or make an order that particular industry ramp up production in order to be able to meet those demands. So GE and a bunch of other companies with respect to the ventilators had to do just that.
Okay, thanks. So what we've been talking about so far are mutually agreeable situations with suppliers. There may be certain suppliers that we consider troubled, probably from a financial situation. So you might need to take more unilateral action in order to enforce your rights. There may be various reasons to do that. Again, that you could be single sourced. There could be a supplier with whom you've shared very critical intellectual property. You might have tooling that you would need to give to a replacement manufacturer. So what are some of the things that you might be able to do? Under the Uniform Commercial Code, if you're uncertain if a supplier is going to be able to perform, even if it's not in your agreement, you can send them a letter demanding to know if they have, so that you can assess whether you have reasonable grounds to believe that they're able to perform within 30 days. And if they don't give you assurance of their ability to perform, then it gives you the opportunity to suspend your performance, perhaps investigate other backup suppliers. Section 2-702 of the UCC gives you the right to demand cash before delivery if you're concerned about the insolvency. And Chapter 11 is not required in order to establish that. If a customer has been sent goods under UCC 702, you might be able to reclaim the goods. Let's see, there's a 10-day demand, and according with that. And under the UCC 705, if you have learned that a customer is insolvent, it gives you the right to stop delivery of goods in transit, even if your contract does not give you that express right. There's also something about suppliers operating in the zone of insolvency, which is a concept tied to state law, which means that if you're in the zone of insolvency, mainly meaning that you can't pay your debts on a day-to-day basis, that you have to consider the rights of the creditors in addition to the other rights to shareholders and so forth that a corporation needs to consider. David Coyle, could you help us understand what the scope of that responsibility might be?
The scope, excuse me, of the zone of insolvency?
Right. I know you said in Delaware it doesn't really apply, but the rest of the states do to some degree.
States, that there are other states that where it applies. It had applied in Delaware, and then through its various court decisions, that no longer became true. And so some states have adopted what was the Delaware practice of the zone of insolvency and have kept it on. The difficulty you have is that if you're dealing with a company that's operating out of Ohio, but it's a Delaware corporation, it's going to be tied to the Delaware law of the state in which it was incorporated. And so, the ability to utilize that zone of insolvency to the creditor's benefit may not be known until you're actually in the dispute with them or actively pursuing them. I think that what is going to become more in play, and we're just going to touch on it, is the idea that I think a lot of bankruptcies are coming. That's been predicted for the last several weeks by lots of different sources. I always remind people in 08, 09, everyone thought there was going to be this huge rush of Chapter 11 filings, And there were an increase in Chapter 11 filings then, but there was not nearly the number of filings that people expected, because back then, debtors' business was so bad that they simply shut their doors. They also had great difficulty getting loans in the bankruptcy, what are called DIP loans. And so that it simply became a practice where the debtors didn't file bankruptcy, they simply closed their doors. This time around, I think that the loans will be available, at least that's the belief. And so that in the next 90 days, you're going to see a large number of Chapter 11 filings from all various sizes of lenders. And the one thing I wanted to just touch on is that in the fall of last year, Congress passed what was the Small Business Reorganization Act, that is to benefit smaller companies, and that the act did not go into effect until February 20th of this year. And then with the passage of the CARES Act actually broadened the scope, because Congress is also anticipating that there's going to be a lot more bankruptcy filings involving smaller businesses. So when the Small Business Act was first passed, the amount of debt you had to have, the maximum amount of debt you could have, was to be able to utilize the Small Business Act was $2,725,625 worth of debt. What the CARES Act did was it increased that from 2.7 million to 7.5 million, so that a lot more small businesses are going to qualify to be able to operate under the Small Business Act. And the significance of that for people who have a lot of experience with regular Chapter 11s is that the Small Business Act is more, in many ways, more beneficial to the debtor. It allows the debtor, the whole idea is to make it simpler, faster, easier, but it allows the debtor to pass a plan without necessarily getting the approval of any creditor class. If they can convince the court that they're not being unfairly prejudicial to any of the creditor classes. It also is going to allow the small business owner to retain his ownership interest in many circumstances where larger businesses in a Chapter 11 typically cannot do that, or it's difficult to be able to do that. So there's going to be an added incentive of smaller businesses to be filing the Chapter 11s. The other thing to note is that the CARES Act changed all preference law, not just in the Small Business Act. And the significant change there for creditors is they raised the cap. Under the former law, the preference claim had to be 14,000 or just under 14,000 or more, or they had to sue you in your home state or in your home area. And they increased that amount to $25,000. So now, if I'm operating with a debtor that files in Delaware, and that debtor wants to sue me for a preference, if I'm owe less than $25,000, they're going to have to come to Ohio to sue me. It makes it less likely, frankly, that they're going to do that.
And explain for some of our non-lawyer friends what a preference claim is.
I'm sorry. A preference claim is that in the 90 days right before the debtor files, Congress's idea is that they're trying to make all creditors be treated equally who are in equal class. And so that they will go and challenge any payment that was made by the debtor to any creditor in the 90 days. And there are certain defenses to preference actions, but under the old law, it was very easy for them to simply look at the amounts that went out by the debtor. And if you got a payment by the debtor in that 90-day period, the debtor would sue you for a preference, basically saying, you have to give that money back because you got favored over other creditors. One of the changes by CARES Act 2 is that it places a duty on the bankruptcy trustee or on the debtor to evaluate what the defenses are before they bring the claims. Now, how that's going to be enforced or how it's going to play out is still an unknown, but it does place a duty. One of the criticisms before was that the debtors didn't think twice about just suing you, even if they knew you had an absolute defense to it, because it was easier for them. And so this new duty will, at least ideally, will make it less likely that they will be filing as many of the preference actions as they were. Also, will have to justify why they didn't take into account defenses. But we're still waiting to see how that plays out.
Where might the bankruptcies be filed?
Well, the bankruptcies can be filed where the state of incorporation. It can also be, it's tied to areas of large amounts of debt, of assets. And there's a reason that, you know, the vast majority of the large bankruptcies are filed in Delaware in the Southern District of New York. And that's because the debtors have the ability to manipulate their subsidiaries and to choose the location where they want to file. And the example I always give of that is the first Kmart filing. That Kmart was headquartered at that time out of Michigan. It had primary assets in Michigan. It only had one smaller subsidiary in the state of Illinois, and yet it utilized that subsidiary to file in the Northern District of Illinois, and then the entire Kmart bankruptcy and all of its subsidiaries all filed in the Northern District of Illinois, even though the primary entity wasn't headquartered there and did not have significant business there. And so the same is true in New York and in the Southern District of New York and of Delaware. And so the debtor has a lot of opportunity on where to choose from if you're dealing with larger enterprises, larger businesses. So just because you're dealing with somebody who's headquartered out of Ohio or out of Indiana doesn't mean that's where the bankruptcy will be filed.
Okay. If a manufacturer is dealing with a troubled supplier, is there any way to manage or streamline the process?
Manage and streamline the process of the bankruptcy.
Right.
Yeah, I mean, again, if it's a supplier that's a smaller supplier and is going to utilize this new act that was passed, supposedly that's going to move a lot faster, but you know, it's going to move a lot faster than the Chapter 11. It is still going to be very slow to the average business person. And so, you know, again, it's a bit of an unknown because so few of them have been filed thus far. But I think we're all going to see many more of those in the next 90 days.
Well, I'm certainly aware of some manufacturers that manage the process by agreeing with the supplier that they would come in and entering into something called an accommodation agreement. They might advance receivables in order to keep them afloat. They probably interact with the landlord if it's a leased facility and a secured creditor to try to reach how the accommodation could be reached if they sort of take over for a period of time, while they may try to arrange for a buyer from a stronger supplier to take in. And it's usually, I believe, followed by what they might be called a prepackaged bankruptcy in order to make sure that the liens are removed so that the successor supplier isn't burdened by pursuing a lot of prior claims against it. Does that work pretty well in your view?
Yes, it does. And the more organization you can have before the bankruptcy filing, the better, and the more quick the process can be. And so to the extent you've worked out deals with either landlords or certain significant suppliers to the debtor, all of that can work much better, and it will offer the protection in a later sale of having a bankruptcy court order, having the sale be free and clear of all liens.
Would you ever resort to receivership or other state law procedures? Yeah.
I mean, it's different state to state. The answer to that is with smaller businesses, the answer is yes. We've had a lot of success instituting receivership actions, being a receiver appointed, and then transitioning the business. And often it involves cooperation of the debtor, but that involves typically negotiation because the principals of the debtor have guaranteed the loans. And so sometimes there's different negotiations that have to go on with that so that you gain the cooperation. But A receivership is a way of handling it with smaller businesses. It becomes a lot less practical in the larger businesses. We represent a lot of buyers of assets out of both bankruptcies and receivers. Buyers typically want to be able to buy the assets out of a bankruptcy just because they're more accustomed to giving these orders that are free and clear of all liens. You can get them, and again, it's different state to state. In many states, including Ohio, you can get those types of orders as well out of a receivership court, but buyers tend to feel more comfortable getting that order, free and clear order, from a bankruptcy court.
Well, hopefully it won't come to that. I think a lot of it is going to rest upon how willing the senior secured lenders are to be flexible in whether or not their customer is in compliance with loan covenants, and whether they'll be willing to forbear for some period of time until they're back in loan covenants. And I know that the FDIC came out with a guidance in March that essentially lasted for 90 days. So I guess we'll have to see if the FDIC will get active in trying to get that extended, because so many bankruptcies could be out there with so many people out of compliance with loan terms.
That is true. And the other thing that will play a factor is whether the lender themselves are having their own issues, which was one of the factors in 08 and 09, yes, was that lenders were not in a position to make loans even if they wanted to because of their own regulatory issues. And I don't know how that...
Which kind of goes back to the government.
Right.
Right. There have been some facilities that the Federal Reserve has implemented, the Main Street lending facility, and some others where they might buy corporate bonds, even ones that are not necessarily rated AAA. There is a limit to what they can do, and I think that would require updated guidance. But we can look forward to maybe some relief coming from that area. That's a wait and see situation. So I'm sorry we're running a little over our 2:30 deadline. Do you have anything to say in wrapping up, David?
I did not, no.
Okay. Wendy, do we have any questions that have come in?
No, we do not.
Okay. So we've covered a lot of territory. We really appreciate all the people who have stayed on the line. We have a website at Shumaker.com, and a portion of it that is dedicated to all of our COVID-19 advice, particularly all the getting back to work advice. When we send out a thank you note, we'll be sending an additional link to that site, as well as Wendy, are we sending the PowerPoint as well?
Yes, we can certainly send the PowerPoint along, and at some point, probably right after this, we'll have the recording available as well. So we're willing to share all of that.
Okay, that's great. So do we have any housekeeping that we've got to do before we end the webinar?
No, I think, unless anybody has a question that they want to email or send on the questions link here on their GoToWebinar. Other than that, no.
Well, we might have overwhelmed everyone. We certainly have provided a lot of content, but there's just so much going on out there that there is a lot to tell. So please feel free to get back to us if there's anything that you need help with as you're reactivating your supply chain and getting ready for internal operations. So from everyone here at Shumaker Loop, we thank you for attending and stay safe. Thank you.
Thank you.